it's time for the panel discussion that we are waited for. First, the panel discussion will be about patient care and IoT, secure and safe frontiers. For that, the moderator will be Shri Padmakumar C, Kerala Medical Technology Consortium Director and Kerala Lifescience Park. I would like to welcome Shri Padmakumar C onto the stage with a huge round of applause. And now I would like to welcome Shri Rajlakshmi Borthakur onto the stage. She is the founder and CEO of TerraBlue XT, mental health care innovator, founder and director of Zanac, worked as director of user experience at Versa, senior manager of Practice Head, India, and assistant director ECM at EY. Ladies and gentlemen, with a huge round of applause, let us welcome Srimati Rajlakshmi. And next I would like to welcome Dr.Philip Mathew onto the stage. He is Deputy Director, Innovation and Partnerships at Believers Church, Medical College Hospital and mentor for health tech startups. So ladies and gentlemen, the panel discussion is about patient care and IoT, secure and safe frontiers. Over to you, sir.
Good morning, everyone. First of all, thank you to the Startup Mission for inviting us for this panel discussion. I understand we have about 30 minutes for our discussion. We have two eminent panelists here. Let me spend a couple of minutes setting out the context for this discussion, after which I will request each of the panelists to briefly introduce themselves, and then we'll get straight into the discussion. So our topic for today, as you can see, is patient care and IoT, secure and safe frontiers. So I am not by any stretch of imagination, a technologist. I, of course, have dealt with technology, but not in the sense most of you in the audience understand it, that is in terms of software or information technology. But here, I think we're looking at the broader concept of technology, and certainly technology is very critical in the practice of medicine and healthcare. Before we dive into the topic, I think it would be good to reflect on a couple of points with respect to what technology does for us. Technology essentially makes things a little easier. It shortens distances, it reduces cycle time, in many cases it reduces cost. So you can reach from, say, place A to B much quicker. You can have a video conference, you can have telemedicine, you can have a consultation across the world if you like, without having to go and physically meet a doctor. So these are all the good parts, the advantages of technology. But technology is, as we all know, a double-edged sword. So there's a fairly extreme case that I want to cite. And the reason I'm citing it is because it is not as far-fetched or distant as we imagine. So there was a pesticide which was invented about 140 years ago. And the chemical composition actually was hydrogen cyanide. It was used first in California by a very reputed company. It was taken up Degussa. The same product, which was meant actually to delouse clothing, to fumigate warehouses and factories, was later used by the Nazis to kill millions of Jews very efficiently. So technology, what it essentially does is it automates, it speeds up, it enables you to do good or bad on a very large scale. So I just want us to keep this in mind. Because sometimes we are so caught up with the good things about technology that we forget about the risks. And that is, I think, pertinent to the subject that we're going to discuss today. The only other point I'd like to make before we get started is technology is all very well, but let's not forget that it is all about patience. So you and I, all of us, we are patients. So no doubt these are wonderful advances. We will hear from Rajlakshmi here, who's actually in the business of coming up with some of these technology solutions. We'll hear from Dr.Philip Mathew, who uses them, who works very closely with startups. But let's just keep in mind that this is a double-edged sword, and we are talking about secure and safe frontiers. The received wisdom and what is normally discussed when we come to such topics is how do we protect the data? How do we ensure privacy? Well, these are very important points, no question. Day before yesterday, there was a news report that 15% of Australia's medical records have been hacked. Some company, I think, has a big insurance company, and millions of people have lost, not lost, the data is up for sale. It is a very real life practical problem that we have. So with these few words, I would now like to request first Rajlakshmi and then Dr. Philip Mathew to briefly introduce themselves, and then we'll get into the discussion.
So, good morning everyone. First of all, I would like to thank all the organizers for inviting me to this August Summit. I hope to do justice to the expectations, and also would like to share whatever I have learned through experience in running running TerraBlue XT. And to give you a brief introduction, so I started my company in 2016, and when I started, the goal was not to start a company. So I was facing an issue. My son has very debilitating epilepsy, and he has a very severe case of it. And whenever he would get an epileptic attack, he had to be taken to the hospital. Otherwise, his life would be in danger. So that was very difficult and very traumatic as a parent. And I was desperately looking for a solution that could tell me that today or maybe in some time my son would be getting an attack, so that I could rush him to the hospital. He would have 20 to 40 minutes. That's the time window that we had to put him in the hospital. Otherwise, it is his life is in danger. So that happened since his birth. And as a parent, you can imagine my condition. I was half mad, thinking about how do I save the life of this little boy. And out of desperation, because I couldn't find any thing in the market, I came up with the solution for the prediction of epilepsy, a technical solution for the prediction of epilepsy, which later got validated by the likes of Intel and TCS and the government of India. And I was funded. I was not seeking funds, which was the irony, and I got funded and I got propelled into the business, and I took it as a calling. That at that point in my life, when I have completed about 18 years of service in IT, I thought that if not for my son, somebody else is going to benefit from this solution, so why not do it? So that's how I started, and it's been very difficult, terribly difficult, and because we are in the medical devices space, and I'm going to share some of my experience with it. It's been tremendously difficult with the funds, with hiring talent, with putting the product into market. But when I look back, I think it's a journey that has been very worthwhile. And one of the reasons I have come here is to share with all the people that are doing startups, is to tell them that you must not give up. I'm not from the medical field, but I have successfully licensed one of our products, to the product for epilepsy, to one of India's largest pharma company. That happened after I sold my house, gave pawned off all my jewelry, absolutely came down on the road, but I just think that you need to keep doing it, and you will definitely be successful. So that's why I'm here, to talk to the startups and tell them that challenges would be there, but it is absolutely worthwhile to continue with whatever you are developing. So the first product is called TJ. It is for the prediction of epilepsy. Currently, we predict epileptic attacks 8 hours in advance. And we are very, very excited with the 5G rollout, because it means that we would be able to predict even faster. The second product that we have is the world's first diagnostic for the automatic assessment of mental health states, which is we can identify anxiety and depression in individuals in 15 minutes. And currently we are working with the likes of the Indian Army and the Indian Air Force to roll out a product. And one of the other reasons I'm here, sir, is to let everybody know that mental health is the next pandemic. Everyone is going through it. And the interesting aspect about mental health is that it can be, people can live a completely fruitful life. There could be a complete reversal in their problems. They can become absolutely normal only if it is detected. And therefore, mass deployment of these things at a very affordable rate is possible with technology. We are bringing it to the public, and we would love to work with Kerala to deploy it for the masses as well. So that is about me, and that's what we are doing. And thank you once again for inviting me to this session.
Thank you, Kerala Startup Mission, for inviting me. I'm not a technology person, I'm a doctor, I'm an intensivist, I'm a critical care consultant. It's over about 4 years that I got into this space, mainly because I felt many of the startups who come up with their products to me or to us, showcasing it, probably are not, I felt that they are on the wrong path, because as engineers you will definitely think there's a problem like this and then I should make a solution for that. But when you come to me, I say, unfortunately this is not what I'm looking for. Your product is good, your technology is good, your solution is good, but somehow that doesn't match my requirement. So that's when I thought, these guys, young guys have left their jobs, and then they are pursuing their dream of a startup with a solution. But there's no real, if I'm just being honest, if one of you come with a particular startup or a solution, you might be an M.Tech from IIT, but you come to me and say, sir, we have got something like this, I just don't have time. This is what probably you will get as a response from many of the doctors, because they don't understand. If you ask me, what is this monitor about, probably now I have some thought about it, but you ask any general doctor about it, they'll say, yeah, that shows heart rate and ECG and things like that, but nothing beyond that. I don't have to know what is happening beyond that or behind the screen or the effort that's put into it. So I work with close to 4 or 5 startups, and in the IoT patient monitoring segment, I've got Stasis from Bangalore, Eve Labs, Dripo, I've been working with for about 3 years, and I've got Wafer Chips from Kollam, whom I've been working for the past 1.5 years. So many of them have come up with a solution, but they just don't know what the medical fraternity needs. So I've tried to help these guys to optimize their use case and to pitch the right way how a doctor or the medical field needs that, and how that will change patient experience or the doctor experience or the actual outcome in patient care. My mentor in startup would be Vishnu from Eve Labs, and because I interact day in and out, in about probably every alternate day we give a call and we discuss a lot of things, not just about Dripo but about a lot of things. So I learn a lot from him. So whatever I discuss here would be what I have gathered over the past 3 or 4 years and from my experience. It's not, per se, I'm not a technology person. And I would invite any health tech startup. It may even not be health tech, but now I just saw Desense. I've been thinking of live, not monitoring, but tracking people, doctors, nurses, and patients. A patient come into the hospital and then they don't know where to go. you go to Trivandrum Medical College, you just don't know where to go to see a particular doctor. So if you have a tag, if you have sensors, it will simply guide you to the right OPD or to the lab. From there you click lab, you go to the lab. You click to the parking, it takes you to the parking. So you've got something of that. So I've been searching for something like that, which like you go into a amusement park, you get a tag, you walk around, come out, give it back and go. So something of that sort. So there are a lot of ideas, I can say a lot of ideas here. If you have something, it can be something that you're using in construction, it can be in IT, it can be somewhere else, but we can discuss, we can see if there is a use case in healthcare for that.
Thank you, Dr. Mathew. Let me start with you, Doctor, since we are talking essentially about patients. So when we talk about IoT and patient care, are we only talking about remote patient monitoring, or are there other applications that you have actually come across? And you mentioned many startups that you're working with. So can you throw some light on what are the other applications?
No, my experience basically being an intensivist, I'll be looking at how quickly or how I can pick up patient deterioration well in advance before I see or before the patient comes to the ICU. That is my aim when I talk about remote patient monitoring. And so all these startups, so you take anything in remote patient monitoring, there are two aspects. One is in hospital, one is in the community. So you need your Fitbit, now Rajlakshmi's product, everything is in the community. How do you pick up patient deterioration in the community? And then probably you can connect it to the ambulance service and they will, you get an automatic alarm. You got this elderly couple staying alone and they've got some device which they trigger when they have a problem, when they have a fall or something of that sort. That is connected to Alexa, then comes to, there's a lot that can happen. Even Alexa, Israel has been trying to bring in Alexa as a assistance in hospital, so that I can just tell Alexa, I need some water, please tell the nurse I need some water. So a lot of non-clinical work gets automated. When it comes to in-hospital patient care, we have got a patient comes into the hospital. From there, you don't know when they're in the hospital because they've got a problem. So it can get escalated, they can worsen, they can improve. Our aim is to get them improved. But we need to pick them early enough. I usually tend to say there is about 6 to 8 hours before a patient crashes in the hospital. So that's the window where you need to pick what is happening or what is going wrong with the patient. There are signs like you got a pneumonia. Before pneumonia, you got a sneezing, you got some itching, there's something happening in my lungs. I'm not feeling well. But then in 2 days' time, you are stuck, you can't breathe, you need to go to the hospital. So that's the time when you have to stop. Your healthcare cost goes down. You crash, you come to the ICU, you spend lakhs and lakhs. So the ICU bed numbers goes down, the hospital beds will go down. You can take treatment to the community, and like ma'am said, e-Sanjeevani. There are a lot of things that can happen along with this. I think I'm going a lot away from the topic. So there's ample opportunities. You just need to think beyond what you can see. You need to see beyond what you can see is what probably if you have seen Lion King, that's one thing that I've always taken to people who innovate. You literally have to see beyond what you can see to innovate.
Thank you, Dr. Mathew. Rajlakshmi, when we are talking about many of these devices, many of them are actually attached to the patient, right? So it could be in the form of some wearable. And we are all the time referring to the plus points, the advantages, which are no doubt there. But aren't there also some risks attached? Because many of these, I understand, are electrical or electronic gadgets. So how is the patient protected?
So you are referring to the safety angle of the patients. So like you rightly said, and we are all, I guess, very right to feel very excited about the things to come in the future with technology advancing so far. As innovators, as co-creators of a new economy, there are the other sides also, especially the darker sides that we have to look into. And we have got to have legislations and framework that will address some of these disadvantages that these new technologies bring in. Okay, and these are generally the areas that people do not talk much about. When we're talking about an IoT summit, generally the focus is on the possibilities. Okay, but then there are the risks also, and both need to go hand in hand. Okay, so I would like to draw your attention to some of the risks that we face as we try to deploy a device, and what are some of the things that we need to think through as companies, as startups, and also at a larger government level. Now, coming to the risk, when it comes to the deployment of devices, see, when we deploy a device, any wearable or any smart device, these devices, by the name Internet of Things, they are connected to multiple other devices. Okay, and there are people, there are these actors that may come in and try to create havoc at every level of the deployment. Starting off with the physical device itself, just using some means of data transfer. I can transfer out data from a wearable at the time of charging. Now Apple is going to come up with Type-C chargers. Type-C could also be used for data transfers. I can just take out data from anybody's phone, anybody's watch. That is at a very base level. There could be issues with common issues like password protections and encryptions and all of that we have been talking about or hearing about from a very long time. But beyond that, when we use a smart device, we need to understand that this device is communicating the data to some other platform. If I'm wearing a wearable or I'm wearing a health patch, this could be my pacemaker, a smart pacemaker, not the traditional one, that can talk to multiple other devices, that can talk to my hospital, that is also connected to my intensivist phone. We can theoretically do all of that. The pacemaker, the humble pacemaker, could be connected to multiple other people, and the goal of that deployment is to ensure that the patient is not at an unnecessary risk. But while that is so much possible, there could be these actors that can come in, and when the data is being transmitted, they can either divert the data or put in some malicious information in that code. And when that happens, the patient's life is at risk. And what kind of risk? We are not just talking about the leak of data. We are talking about the actual possibility of an electrical interference that could be induced into that pacemaker. Just imagine that.
Is there any regulation in India today which will help safeguard against such risks?
So unfortunately not in India. The first such regulation came up, series of regulations came up in the United States. And I think California sometime back actually passed a bill to safeguard people against such risk. But we are aware of it because we are working on a medical device which is IoT enabled, which is AI enabled. Okay, so many companies are not even aware of these risks. Through experimentations in the lab, we identified that I can actually induce an electric shock on somebody who is 5,000 miles away. How about that? Right? So the possibilities of electrical safety, biohacking, and then there is this issue of ethics, which is again something for which we do not have regulations. Now I can stream data from all the people that wear our device. And what do we do with that data? Of course, we could use it for analytics. But could we sell this data? Very intrinsic data about somebody. Like say, for example, menstrual cycle, or fertility data, or mental health data. Imagine the kind of data, and they will go for millions and billions of bucks. So, do we sell it? Now, we have actually come across organizations and startups that have not thought of the larger implications but want to make money using that data. Now, it's a personal call, it's a business call. It is absolutely okay for them to think business about it because business is business. But what about ethics? So, as a company, we have decided that we are going to draw a line around what kind of data we are selling to organizations. Even when we take corporate data, the corporates are not able to identify who is who, and they are not able to take an action on one individual based on our data. So that's a company call which we have taken. But it is not necessary that everybody will take these kind of calls.
This is a very interesting and I think very important issue that you raised about ethics. So I'd like to ask Dr. Philip Mathew. I understand every hospital has an institute ethics committee. So for the kind of devices that we are talking about, does it come within the purview of your hospital's ethics committee? Do they discuss it at all? What kind of safeguards are there in your hospital?
No, sir. Actually, if we need to deploy a device, that doesn't go into the ethics committee. But what we are trying is whatever new thing come up, any device, we take it through a research proposal. So we, even with Dripo, now we are working on a study. So that study will actually go through the ethics committee. So then they will evaluate whether there are any ethical issues, any data issues, or what is the harm to the patient, or what is the benefit. Is it just a commercial entity, or is there something useful? Because it's a new thing. You bring something from Philips or GE, no one is bothered. No one is going to ask anything. So we assume that everything is safe and sound. But when it comes to a startup, it's an extremely tough world that you come up with something, we are not going to believe what you say. We need papers, we need research, we need publications, we need all these things to be done. So that is how we approach, because we are scared. Because tomorrow someone is going to say that this particular hospital, now even to me, I am scared when I take up any startup because someone is going to say, you are connecting patient this thing and selling it to. I mean, there was a news with Sri Chitra and Monash University, and I mean, if it is happening with Sri Chitra, how as a private organization I'm going to take that risk? So it's a very, because there is no clear guideline as to how this has to be tackled. But at the same time, I would say, without patient data, without whatever data we are talking about, none of the engineers are going to make anything new. Because you need to test, you need some information, you need that interaction. So, as of now, I am playing safe by selecting startups which do not have any direct intervention with the patient or where it doesn't harm the patient.
So, sir, one of the things around ethics is that when we present something to the ethics committee, it's very narrow. It's only about the study and the patient population. And it's not about the business, it's about proving that concept. Implementation, or when you're doing field trials, that's when the game changes completely. Now you suddenly have access to thousands of millions of users. And the business side looks very lucrative. So what do? But unfortunately, we do not have guidelines. And maybe Kerala can start by having some guidelines in place because you are the first in so many things. This is something which is required not only in India but across the world. So some thoughts could be put into this.
To add to that, we've had startups come up with projects where CT scan, or it can be in radiology, it can be in anything. But in every MOU, there's a clause that we have the right to use this data as we wish. Then we just keep it away because we don't know tomorrow what is going to happen to that. We don't have clear guidelines from the government as to how we are protected when we help someone. So that is something the government has to address.
So while on the subject of safety, because that's what we're talking about here, are there any certifications or quality standards that you follow, for example, with the kind of products that you make?
So in India we have the CTSCO, which is loosely based on the CE, which is used in Europe. Again, in Europe, many countries, several countries have their own standards. And these covers standards for electrical safety, for all the claims that we make around, say, water resistant, this resistant, that resistant. So there are specific part numbers and line-by-line guidelines around how a device would qualify to be a medical device. So those certifications are a must if we are selling something as a medical device. And then of course it has to go through several levels of clinical trials, but done by an independent authority like a CRO. And then of course the most common one is and the most famous one is the FDA. And FDA also has very stringent guidelines around what qualifies as a medical device. So if we are looking at creating any device which is for medical use, then these certification is a must. Otherwise, they fall in the wellness category. They are not medical device. Yeah.
So ladies and gentlemen, now it's time for the Q&A. Those who have queries or doubts regarding the topic that we are discussing here, you can switch on your mics and ask the questions.
Okay, as far as I hear, so the regulation is not available in India to protect the data privacy in the medical field. Is that I am hearing?
No, so there are regulations that are out there, but we are talking about IoT specific applications. So general data protection is there, like so many things have been used, but we are talking about, there are no regulations around how do I transfer data between my smartwatch and the cloud. There is no medical regulations there. Okay, so we need to have proper guidelines around those things, and also around AI. There are so many things around, so many of us use AI, IoT and AI almost go hand in hand. So there are no regulations around how we can use these tools to ensure that patient safety is foremost.
I hope it was clear. And anybody else have questions?
My question is addressed to ma'am. You mentioned about wearables are quite expensive. Obviously, cost factor is quite high. Are we looking at frugal innovations in the wearable space, which can scale up the activity, and perhaps we're looking at a larger segment where to use this?
Yes, so I would like to give the example of the Geo phones. So you have the frugal as well as you have the smartphones. But people still want smartphones in Kerala. Why? You have the option of going for the frugal innovation, and people do that because they're looking for things that are relevant for them. They want to share a photo, they want to communicate via video, and so on and so forth. So depending on the use case, there could be situations where people are using expensive electronics versus frugal stuff. And so one of the things that I would like to clear is that many people ask us that your wearables or whatever you're making is very expensive. How do you take it to the masses? And so in the past, we would always think that we have to always look at the model where we are selling the hardware to the individual for them to use. But if you look at how service is delivered now, the rent model is also the subscription model, where you need not own the device. You could always have a kiosk where 100 people come, and that's how you can bring down the cost of implementation. Everybody gets the benefit. They need not own the device, but the device is deployed maybe by the government or by a corporate, and so many people, thousands of people can benefit from it. So I would like to say, sir, that we will have to understand where we really need the frugal innovation versus where we find alternative implementation strategies for high-end innovations. The reason they are high-end probably could be the cost of making them. You cannot compromise with the chip, you cannot compromise with the technology, or the rent that you're going to pay for your cloud storage or for your data communication. So even if the company is not making money, you will still have to pay for all those charges.
Thank you, ma'am. So, okay.
I would like to ask, ma'am, is that you are talking about the preventive nature of the devices. What about the curative level? Where do you balance? Because from the patient point of view, quality of life after the incidence of a disease is more important than anything else. So how does this intervention come?
Sir, so several organizations are working on in this aspect, and so are we. Like for example, in terms of treatments, when it comes to anything invasive, then it becomes they have to go through very serious, very stringent trials, starting off with animal models and taking it to the next step. And therefore, lots of amazing technologies are being developed, but they are still in that incubation state in different universities or labs around the world. Because when it comes to delivering a treatment, we are looking at messing with the system, via technology. And for anything like that to come up, tons of investment, tons of manpower, the great scientific minds are all required to make that happen. So that is one aspect of it. The second aspect of this, one good example is we have these implantables for even say epilepsy, where before an epileptic attack happened, this device sends to the vagal nerve, it sends a message and stops the attack. It actually stops the attack. Now, the implantation cost of this is upward of 6 lakhs. It's been developed, it's there in the market. But we are looking beyond epilepsy or something which is a little difficult to manage or quite niche. We're talking about say lifestyle diseases like hypertension or say diabetes. So for these kind of diseases and disorders which are brought in by our lifestyles, there are several options that are currently being able to. Our technology, sir, enables we not only monitor the stages, life stages of an individual, but we focus on the recovery angle. Our solutions are recovery focused. As in, if we keep telling somebody that you have anxiety or you have depression, it's going to make them very depressed. Rather, we are telling them what is it that brings in their calmness, what kind of activities or things that help them to settle down, make them more engaged. So these are technologies that do not actually provide the treatment, but ensures that that difficult stage where somebody gets into an MDD, major depressive kind of disorder, does not happen. So that's
So just to add to that, being a doctor, if you come up with something that is new, if you are a patient, I tell you there is something new, but they're trying it out. It might be harmful, it might help you. Definitely you wouldn't take that up. You need something sure. I'm ready to spend 1 lakh. You give me something that works. So there lies the problem. So if as common man we are willing to be experimented, probably the guy sitting here would be able to help.
The issue here is that the patient's first trauma is that whether the doctor is giving a commercial prescription or a medical prescription. So once that trust is established, then whatever the doctor says, the patient does.
But at the same time, if now from believers, if over the next 10 years we become an innovation hub, we have all the startups coming and experimenting things. In 5 years down the line, people will keep saying, so where do we draw the line? How would someone bring in something new? So again, I don't know who should take that action.
Maybe I can comment on that, Dr. Philip, Mathew. I think maybe the doctors should take the first step, and I'll tell you why I'm saying that. In my career, I was associated with a blood bag manufacturing company. So the blood bag was invented by somebody called Dr. Carl Walter, and he is considered one of not just the great doctors of the 20th century, but also one of the great inventors. And I think the lesson from his life, which we have seen in the West, many of the inventions that we're talking about are actually done by doctors, not by engineers. But unfortunately, that's not the case here. So I have this strong recommendation that maybe the doctor should take the lead.
That's why, sir, I said I try to be the bridge between engineers and doctors. So if there is any engineer who can support us, come up with your expertise, we can come up with our problems and probably merge and produce something useful.
Thank you so much. Actually, we are running out of time. I'm sure that this discussion is a little bit interesting for everyone. And we are discussing about the patient care and IoT, secure and safe friendliest. So, definitely our experts are here. You can reach out to them. You can discuss. You can ask the questions and all. So now it's time to honor our moderator as well as the speakers. So I would like to welcome Padmakumar sir to hand over the small token of love and appreciation for Srimati Rajlakshmi Borthakur, founder and CEO of TerraBlue XT. Ladies and gentlemen, put your hands together for Srimati Rajlakshmi Borthakur for spending time with us. Thank you so much, ma'am. Next, I would like to welcome Dr.Philip Mathew to receive a small token of love and appreciation. Dr.Philip Mathew, Innovation and Partnerships, Believers Church Medical College. Thank you so much, sir. And now it's time to hand over a small token of love and appreciation for the moderator, Sri Padmakumar C, Director of Kerala Medical Technology Consortium. For that, I would like to welcome Ms. Surya Tanga, Manager, Kerala Startup Mission. Ladies and gentlemen, put your hands together for Sri Padmakumar C for being a moderator for the session, Patient Care and IoT, Secure and Safe Frontiers. Thank you so much.